Okay, so pharmacology of the next drug. We get to look at another cancer drug, and this is known as what Busulfan. Okay, so this Busulfan is sold under the brand name what Myleran. Myleran. Okay, so it's actually a chemotherapy medication. Right, it's a chemotherapy medication. All right. So we'll talk about this from the mechanism of action, pharmacokinetics, clinical uses, adverse effects, and the rest of it. Okay, so that this Busulfan is a chemotherapy medication which is used primarily to treat what? Chronic myelogenous leukemia. Alright, and it's also used as a conditioning agent before bone marrow transplantation. Okay, so what is the mechanism of action? This Busulfan is a bifunctioning what alkylating agent. So it works by alkylating the DNA. All right. So it will therefore lead to what? Cross-linking, and it also cause damage to the genetic material of the the cancer cells. Okay. It also lead to the okay. So for the pharmacokinetics, for absorption, we said that Busulfan is well absorbed orally and is also administered intravenously. So what we got here is actually the intravenous use on. Alright, we also have the oral ones. For distribution, it is highly lipid soluble, allowing to cross allowing it to cross the blood-brain barrier and distribute widely in blood tissues. For metabolism, it is extensively metabolized in the liver through glutathione conjugation followed by oxidation. For excretion, the drug and its metabolites are excreted primarily in urine, about 25 to 60%. All right. For half-life, the elimination half-life is about 2 to 3 hours. Okay. For clinical use indication, this Busulfan is used to treat what chronic myelogenous leukemia and also a conditioning agent before bone marrow transplantation is done for various leukemia situations, lymphoma situations, and myeloproliferative disorders. Okay. For adverse effects, it can cause bone marrow suppression, pulmonary toxicity, hepatotoxicity. Okay. So other side effects can include things like what? Nausea, vomiting, hyperpigmentation. All of these are common when using Busulfan. Alright. So on that basis, that was a brief pharmacology of this chemotherapy drug.